recent years have seen an alarming rise in cardiovascular issues among athletes, raising concerns in the sports community. Now, athletes who are often perceived as the epitome of health are unexpectedly facing heart-related problems. Now, contributing factors include intense physical demands, undetected congenital conditions, and stress. Now, despite rigorous screening, some conditions remain unnoticed until a crisis occurs. High-profile cases, including sudden cardiac arrest during competitions, have highlighted the need for enhanced cardiac monitoring. Now, since 2020, several high-profile athletes across various sports have faced cardiovascular issues, highlighting the importance of monitoring heart health in sport. Now, during the UEFA Euro 2020 match between Denmark and Finland in June 2021, Danish soccer player Christian Eriksen collapsed on the field due to cardiac arrest. He was revived on the pitch with a defibrillator and later underwent surgery to implant a cardiovascular defibrillator (ICD). Others include Sergio Agüero, who is a footballer who was forced to retire in December 2021 after experiencing chest discomfort during a match for FC Barcelona. American tennis player Jensen Brooksby is also part of the list. In July 2023, Bronny James, son of NBA superstar LeBron James, suffered a cardiac arrest during a basketball walkout at the University of Southern California. Chineme Martins, may so rest in peace, of Nasarawa United, on Sunday, 8th of March 2020, slumped and died during a Nigerian Professional Football League match day 23 in Lafayette. Now, these cases illustrate that cardiovascular issues are a serious concern across different sports, affecting athletes of age, of fitness level, or different parts. Now, the role of lifestyle, diet, and recovery protocols in cardiovascular health is increasingly under scrutiny. Now, joining us to talk on this health-related issue is a sports doctor and National Publicity Secretary, Nigerian Association of Sports Medicine, NASMED. Dr. Babatunde Akinbinu joins us this evening. Good evening to you, Doctor, and welcome to Game On.
Good evening, Pedro, and it's good to see you again. It's also good to see Wale Ajikun. Great to put a face to the name, and good evening to Nigerians and everybody watching us around the world.
All right, thank you very much for joining us. Doctor, we've seen the recent trend in sport, and it's not about, in the last 5 years, it's been on, and it's a matter of concern, especially with sportsmen and women. What are the common cardiovascular issues found in athletes today? And what would you say that this is the basic, amongst all of them, this is the one that we should focus on, when we have athletes participating in sport?
The irony is that athletes indeed are usually the fittest individuals of any subgroup of people around the world. So it becomes a situation of real concern when an athlete slumps or has a sudden cardiac arrest or sudden cardiac accident or these cardiovascular challenges. But aside that, athletes usually have the best fitness levels, and the challenges are usually musculoskeletal, while competing or after competition. But then there are a number of conditions that will affect general population that will also be highlighted in sportsmen and women. One of them is cardiomyopathy, and there are various ones, and I'm not going to talk about the complexity of cardiomyopathy here, but it's an unfortunate cardiac situation where it leaves little or no symptoms before the person suddenly drops dead. It's a particularly worrisome thing. Now, there are ways to prevent it in sports and activities, of course, in the developments and advances in sports and exercise medicine. But of course, cardiomyopathy is the biggest challenge, hypertrophic cardiomyopathy, for example, with sportsmen, where people, in spite of doing the very best forms of preventive activity in terms of pre-competition screening and all of that sometimes we just have those challenges. However, when we come to the Nigerian context and the low and medium income countries, there are also several other challenges like availability of facilities, the quality of pre-competition screening, the quality of personnel that are available to take care of prevention of accidents and of this form during sporting activity that are available at sporting venues or even at training venues across the country, especially in this part of the world. These are all concerns that we must address. Of course, there's also education and awareness and all of these challenges about people not even knowing what to do, where there might be such situation like you did mention where there was Fabrice Mamba in England. he had a cardiac arrest during an English Premier League game. He had immediate attention to take care of it, and of course, he came back from all of that. There was also Dan Blaine. There's a Danish Christian Eriksen, if I'm not wrong. That they had these challenges. These are players that operate at the highest level of fitness. You want to compare that. Kanu Nwankwo always had a defect in his heart, all the while he played for in the Nigerian league. If I'm not mistaken, he played for Nwanyan National or thereabout, before going abroad. But he's played all the time in Nigeria. He's played in Ajax. He was only transferring to Inter Milan before all of that was discovered. So it's the quality of knowledge that's available, and then thereafter it's about how much facility do we have to diagnose and provide immediate care where there might be cardiovascular challenges in sportsmen.
All right, well said, Doctor. I would like to bring it down to, of course, Nigeria, like you just highlighted some things and what happened in Nigeria. The last time we had issues like this, it was a disastrous one in the sense that we lost a soul on the day. That's the Nigeria Premier Football League, and it's obvious that after then, ambulance were said to be a prerequisite before any league game should go on, and we all know that it's not in every venue. When you look at how consistent we have such kind of rules being implemented. Now, how can we detect these signs early? We know that not every club in Nigeria puts their players through medical tests before signing them. What can be done to avoid issues like this, or how can we control it whenever it happens and not have a case of death?
All right, so this is where the crux of all of this conversation is about. It's about ensuring that the society has the knowledge to do what we should do in order to prevent and to immediately act when we have such situation. And so in the Nigerian Premier Football League, and a lot of people see me as a huge critic in many places, but I did say in those days where we had the LMC, they said the LMC was not enforcing the biggest sporting protocols that has to relate with medical facilities in the stadium all over the country. We simply play lip service. We only complain when it has happened. We listen to all the experts. So I do this every year, every August. In fact, this is the month of August. So every August, we remember Sam Okwaraji as it passed on in '89, and then I get all these phone calls again, but we really don't do anything. So that's where the challenge is. What we should do going forward should be to say, let's have medical facilities in every stadium in Nigeria, at least in state capitals, where there is a doctor that has a medical team in every stadium. That way is attached to all the teams. A doctor or two doctors, it's a medical team anyway. And then, of course, let's take pre-competition medical assessment a lot more seriously. So there are things, for example, like electrocardiographs. There are even echocardiograms that can be done to ensure that we check stress ECG and resting ECG. There are manners. We've lost a number of people in the countries, not only in the male league, even in the female league. Just that it's when they die during football matches or thereabout that will give it a lot of attention. The truth is that sometimes players die at training, sometimes they die off season. So what should we do to list it 1, 2, and 3? First, let's ensure we do elaborate pre-competition screening all over the sporting space in Nigeria. Okay, especially in football, which is because sports essentially is a high intensity activity where practitioners or athletes are expected to perform at nearly superhuman levels in order to defeat the opponent, whether it's a team sport or an individual sport like tennis or a team sport like football. So at that rate, people are working at nearly maximum cardiac output, and they are pushing themselves to the limits of their natural capacities. At that rate, they run huge risks of all manners. So what we need to do is to, before each competition, we take PCMA, pre-competition medical assessment, very important. Then we also prepare basic life support, advanced cardiac life support capacities for teams around the country, where we ensure that people have the knowledge to prevent or act immediately. A person doesn't collapse, for example, and you are just lifting the person up like if it's a sack. No, there are steps to do it. There's the ABCD of resuscitation. You want the average people to know how this is done. You also want to educate people about what cardiac arrests are and what should be done. Coaches, athletes themselves, so even spectators, at international competitions, some of which I attended, for example, there is a medical team even for the crowd. That's supposed to be in Nigeria, but we really don't do it. So we are paying lip service to a number of things. There we must put policy in place to ensure that if states, competitions, organizers, or whatever sporting association do not have basic minimum standard in terms of sports medicine facilities and sports science structures, it doesn't go on. We should have defibrillators around, for example. These are common things in the developed world where on the street, at street corners, there are defibrillators. The person goes into cardiac arrest, you can shock the person back to life. Those are ABCDs of cardiac life support and all of that. But we really don't do all of that here. And we play a lot of lip service to it. And I hope we can begin to call upon the professionals and places to ensure that they guide us through all of this as we go forward in this country.
All right, well said, Wale.
Yeah, hi, doctors. Good to hear from you. And I wanted to, by the way, I mean, we had another occurrence a couple of days ago. One is Querétaro.
Yeah, it's correct.
In Uruguay with Nacional. I think there's also the place of the act of God. I mean, the fittest of players go through some of this rigorous medical, tests, and some of them still, get to collapse. But I wanted to ask you, as Publicity Secretary of NASMED, what are you guys doing? You've talked about policies, you've, in quotes, lamented the situation right now. But from a policy point of view, what is NASMED doing to put pressure on, for example, the NPFL, to put pressure on the Nigerian National League? I'm a sporting director at the NLO, that's the third tier. When we were playing the playoffs, the regional playoffs in Kwale, Delta State, there was no ambulance. Yeah, there was no ambulance. All through that playoff that lasted about a week plus, no ambulance. That's in the third division. So how much pressure are you putting even on the government at NASMED to ensure that we can fix all of these things? Even if you can't do a quick fix, let's start, pushing these policies, and let's start putting, these machineries in place to ensure that we don't have to wait for the next big casualty again before we start talking about this.
So that's nice and absolutely wonderful question. And the act of God, like you started with, is absolutely true. Even at the best of facilities and the best of places in the world, there can still be deaths. I mean, Mark Vivian-Fo was said to have just a 1% chance of that manner of accident. Danny Blind, for example. I mean, Eriksen, had a Fabrice Mwamba. These are people who have gone through very elaborate testing. And this, I've mentioned cardiomyopathy, for example, that doesn't give any, it gives little or no symptoms until the patient is actually dead, athlete or not. So sometimes those things really do happen. But there are simple ones that you can find ways of preventing. There are matters as simple as even nutritional deficiency that can play a role into electrolyte imbalance and all manners of things that affect cardiac activity, because it just has to have cardiac arrhythmia and that's all gone. So what is NASMED doing? So NASMED is the National Association, Nigerian Association of Sports Medicine, where people like me put ourselves together and we do all of that. It's been recently resurgent, it's been a little comatose for a while, but 3 months ago, we all put ourselves together and we have a national body and we're looking at doing some of these things. But in personal capacity too, I've said these things at various fora. I mentioned earlier on that I do this virtually every year. I get phone calls to say, so what do we do better and all that? I know Dr. Prince Pambo, for example, for Ghana, who keeps the African directory of sudden cardiac accidents and sudden cardiac deaths and all that. So we keep talking about this, but the sports medicine in Nigeria at the moment is actually led by, of course, the biggest sports medicine departments in Nigeria. That's the National Sports Medical Center at the Ministry of Sports in Abuja. And of course, there's a fine department at the Lagos State government too. There are a few others around the country, Edo State, Gombe State, and all that. Don't ask me about Edo State, where I function as a public official primarily. So there are capacities, but when I say we pay lip service, we don't do enough. Now, speaking about the NLU, where you acted at some point in time, I'd actually written, in personal capacity, and written a proper essay that I shared with the Nigerian Football Federation a couple of years ago, stating the amount of pressure that we put the human body onto by exposing players to the kind of unimaginable competitive environments? How do you play 8 matches, 9 matches in 7 days? Or you play what should be the third tier division league, like you mentioned, where they play 6 to 9 matches in only they virtually play every day with
Back
only
to
1
back,
day break.
yeah.
It's not professional. It's not professional. You put them under terrible risks, and they have to play with all manners of substances that are inimical to their health and are inappropriate even for the sports. So we're not paying enough attention. That brings us to matters like doping control. But there are many challenges, Just bring the experts on board and hear them. Don't just hear them. Let them also direct, let them lead, and please give them the opportunity to try. But when we keep talking from the outside and the practitioners want to do whatever it is they want to do and they get away with it, it becomes a real challenge, But the capacity is available. There are a number of sports scientists and sports officials in Nigeria that can lead all of this. And the country is aware of this, but we're simply just not doing this.
Right. Thank you very much, Dr. Babatunde Akinbinu, for your time. I mean, you've given us, deep insight and what we must do to prevent, and whenever it happens, how to control it and hope that it doesn't get to a terrible situation. Thank you very much for your time, and would hope to have you subsequent editions of our show.